Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with weakness. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with weakness. When you come to the ER with weakness, your doctor is usually thinking of many things. These can be anything from anemia, infections, and electrolyte issues, all the way to strokes, heart attacks, or organ dysfunction. Please don't let this scare you. Weakness is just a very vague complaint with many potential causes. There are many basic and treatable causes of weakness, but it would be too complex to review every cause in this video. This is why it's important to rely on your doctor's expertise and to honestly answer all of the questions that your doctor is asking you. After speaking with you, your doctor will have a better idea of what could be causing your weakness and will likely run some tests to investigate what is going on. You'll very likely get blood work done to test for many of the dangerous causes of weakness, including, but not limited to, infections, blood loss, electrolyte issues, and possibly heart conditions. Additionally, you'll likely get an EKG done to evaluate your heart's rhythm. Depending on your doctor's evaluation, they may decide to obtain other tests or imaging. Once everything is complete, your doctor will speak with you regarding your results. If your doctor found something important, they will discuss it with you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. Remember, if your doctor sends you home, it does not mean that everything is perfectly fine. It just means that many of the big and dangerous causes of weakness could not be identified on this visit. Again, weakness can have many causes, and it is very important to follow up with your primary care doctor to fully evaluate if other causes exist. These can be more rare causes, such as issues with cortisol release or thyroid issues, or even more common issues such as medication interactions or taking too many medications. There may also be other slower or more chronic issues that can cause long-term weakness. Remember, your primary doctor has the benefit of being able to see you over multiple visits, and time is a very valuable diagnostic tool, which is often not a luxury we have in the emergency department. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.